Hello everyone, this is Deepthi. Today, me and my team will be addressing the current issues at Toronto Hospital and provide recommendations to solve and prevent them from occurring again. The hospital is failing to document and communicate incidents effectively, like slip and fall accident was not documented properly, nor it was reported to the Ministry of Labor. Workers' absenteeism due to safety concerns was not addressed. Harassment and violence incidents were not logged, and there weren't any corrective actions taken. So, this lack of reporting created a very dangerous environment in Toronto Hospital. The immediate action that could have been taken by HR were reporting the incident immediately to Ministry of Labor, like injury or workplace harassment and violence should be reported as soon as it came to the HR's notice. HR could have filed Workplace Safety and Insurance Board Form 7 and then helped the injured nurse to fill the Form 6. That will be helpful for her to do financial help. It is also management's responsibility to investigate harassment and violence complaints following OHSA Section 32 protocols and ensuring appropriate disciplinary actions and implement measures to prevent this reoccurrence. The other recommendations that I would give is strengthening and streamlining their reporting channels. For instance, developing an accessible online reporting system where employees can log into and file their incidents confidentially. That will helpful in most of the harassment and violence case. Next is to train all employees and supervisors on the importance of reporting and how to document those incidents correctly. HR must promote no blame reporting culture in the organization where employees can report their incidents without any fear. Then establish an accountability mechanism where supervisors and managers review and act on all incidents report. They can also involve joint health and safety committee if required. Lastly, but it is very important step where HR and management should conduct regular audits to ensure all incidents are reported and managed, and HR must regularly review and update policies to reflect the legislative changes. Amit will explain the next issue.
Okay, thank you, Dipti. Now I will explain the issue of refuse to do unsafe work, which lies in under Section 43 of OHSA. In this incident, where two nurses refused to work in the ward, where confirmed measles patients were hospitalized, and nurses has a fear to explore the measles. So, for to address this issue, I have some recommendation which include infection control and safety protocols, under which providing PPE kits like personal protective equipments, isolation and quarantine measures, and provide vaccination and immunization to the employees who have weak immune system. Second one is training on a right to refuse unsafe work, providing right information about right to refuse procedure, and also establish OHS committee involvement would highly address this issue. Also, providing risk assessment like hazardous identification and providing risk management plans to employees will also help in addressing the issue of right to say unsafe work. And also strengthen communication and reporting mechanism, which include clear communication channel between employer and employees, and regular updates on safety protocols will help in addressing this issue. Also, temporary reassignment and paid leave for at-risk employees will help to address this issue, which include reassignment and providing paid sick leave to the workers who get infection to this disease. Now, my another teammate, Ame, will explain the issue. Thank you.
Thank you, Amit. Myself, Amay, and I'll be discussing the key recommendation to tackle the hazardous work environment caused by poor housekeeping and waste management at Toronto Hospital. So the first recommendation is infection control policies, enforce strict waste handling guidelines, and train staff for safe disposable, and especially in high risk area like emergency room. The next is PPE and training. Provide essential PPE and teach proper use to protect custodial staff from contamination. The next recommendation is housekeeping systems. Establish routine for cleaning and trash removal with backup team for staff shortage. The next is OHS audits. Conduct regular safety audits to identify and promptly address hazards. And the last recommendation is mental health support. Offers resource to reduce stress and improve morale among custodial staff. The next issue will be taken care by Pragati.
Hi, so I will further explain about the recommendations for addressing the workplace stress at Toronto Hospital. So, first recommendation is provide the workplace stress risk assessment. Employers at Toronto Hospital should regularly conduct the risk assessment to know about the factors such as the workload and inadequate staffing. This is given under Section 25, subsection 2H of the Occupational Health and Safety Act. Further, establishing the Joint Health and Safety Committee is another recommendation. The workplaces which have 20 or more regularly employed workers must establish a Joint Health and Safety Committee. This is given under Section 9 of the Ontario's Occupational Health and Safety Act. The third recommendation is about providing the stress management training. The employers should give the proper training and information to the employees on the health and safety, including the stress management techniques. The hospital should conduct the workshops and training sessions on the workplace stress management. Now over to Hetal. She will explain about the next recommendations.
Thank you, Pragati. I'm Hetal, and I would like to discuss today the workplace harassment and violence. And here I would like to give the recommendation mentioned below. The first is implementation of preventive measures. HR has to strengthen workplace security by installing tools like security cameras, panic alarms, and ensuring restricted access to the sensitive areas. The schedule must be planned in such a way that to avoid risky situations such as late nights and house call. The second one is de-escalation and conflict management. The staff must be equipped to handle difficult situation. Mandatory training session in de-escalation techniques and conflict management can help employee remain calm and effective in tense situation. Lastly, the policy update and awareness campaign. HR should regularly review and update policies to reflect current risk and communicate this update regularly to all the stakeholders. Next, Ria will present the last topic.
Thanks, Hetal. So I'm Ria. I wanted to talk about the issue that is inadequate safety management and system and crisis preparedness by the hospitals. So for the recommendation to tackle this issue is the regular risk assessment should be done by the hospitals, authorities, and the department in operating rooms, staff break areas, and patient rooms, so that in prior to the any incident they can know which incident might have happened in the future, and they can take a preventive measures to resolve those. Second one is prioritize safety, involve staff in safety planning, establish recognition programs so that they can create awareness among the staff members so they know it how to identify the various risks. And the last one is the hospital should invest in role specific training, safety initiatives, and staff education and refresher course on a new safety protocol so that every staff member can get well equipped knowledge about all these hazardous situations and take a preventive measures before it become the worst. And these are the references and the sources from where we have picked the information. Hope you guys loved it. Thank you.